Welcome to the show, Lori Sonnenberg. It's such a pleasure having you. How are you?
Hi, Marissa. I'm doing great. Thank you. How about you today?
I'm doing well, except my cat is meowing. Charlie, he needs to know his place. But no, it's such a pleasure having you. And there is so much information that I want to extract from you. I'm totally going to be geeking out. You're
Oh,
the
yay. I'm excited. I can't
you're
wait to geek out with you.
Yeah, so you're the first speech pathologist that I've interviewed, and I truly have a million questions. So let's start unpacking you. Let's start getting to know you, Laurie. You are a licensed speech language pathologist, a
That's right.
clinical voice specialist, and singing voice specialist, and you're based in Chicago, one of my very favorite cities in the US. And you're also a soprano. You
I am.
have you have a Bachelor of Music degree and a Master's of Music. There is so much to learn about you. So let's start with, and I love doing this with all my guests, is finding out, okay, so as a child, did you
Hmm.
sing? And when did you actually figure out that, okay, I'm not such a bad singer?
Oh, yes. I'm pretty sure I have memories. I don't really have a lot of life memories that don't involve singing. I have memories from such a young age singing. My mom, uh, my whole family was musical. Both sides of my family were musical, and my mom really wanted me to play piano and exposed me to a lot of music growing up. And so I started studying piano very young as well, about age 5.
Hmm.
But I have memories of doing solos at little music clubs and things, even at that early age. I think my very first public solo was preschool graduation,
Wow.
somewhere over the rainbow.
Oh, of course. What else?
Yes, and my parents still have like a cassette tape of me
Oh.
singing it.
Oh, I would love to hear that. You'll have to put it up on social sometime.
I know that would be great, wouldn't it?
Yes.
So I did a lot early on, just singing for we. I grew up in a really small town in Northwest Louisiana,
Hmm.
and but surprisingly, we had a really robust music community. The music teacher, the National Music Teachers Association, had a club there, and so I had my very best friend's grandmother used to host these old-timey salon gatherings in her front parlor with her grand piano, and I would go and sing for all these old ladies
Oh
at the
gosh.
uh, at the music club meetings. And so that those are my earliest memories of doing that. But then I really feel like church was where I started kind of being shaped as a singer and a
Hmm.
musician. It was a great outlet for me to play and to sing. I started participating in choirs and so forth. And I had a choir director who took an interest in me. I was about 11 years old, and he went to my parents and said, "There's something here. Like, there's something going on here, and we need to foster it."
Hmm.
And so that was kind of how it all began. I started taking voice lessons and
Yes.
never looked back.
Well, thank goodness for that. So you went on to study uh, voice and vocal pedagogy formally. What happened first? I know that you've done some teaching, you've had a little performance career, you've done some teaching, and then you transitioned into speech pathology. What was that journey like? What order did all that happen in?
Uh, you know, I started out like a lot of young singers who were gifted in the classical realm. So I my voice was really well suited to classical singing,
Hmm.
and I was a high soprano. I was also a really strong musician, so I could learn and sing very difficult music. And so, uh, I was really focused and motivated about just pursuing a big performance career in opera. I mean,
Right.
that was what I thought I wanted to do. I would envision myself at the Met and in Europe and gallivanting about and singing and doing all and knowing and learning all the languages and that was really my focus for most of college. I was still pretty focused on that, but during college, I took my first pedagogy course, which is kind of unusual for undergraduates at that time. That was
Yes.
in the 90s,
Yes.
and it was an old book, but it had these hand drawings of the larynx and the anatomy and physiology, and we started learning about injury. And
Really?
I never had injury, and not I was fortunate as a singer to never have really struggled, but I had a lot of friends who were music education majors who were struggling and getting diagnosed with nodules and different things. And so I was sort of observing all of this as a very young singer and wannabe teacher.
Hmm.
So I tried teaching very young. I started teaching lessons when I was like 19, which I
That
would
is
never
young.
want someone to do that now, but I look back and it was just a good fit. I was good at teaching music to young people. And so I used my piano skills and just my budding skills as a voice teacher to, start playing around in a private studio setting with other
Hmm.
voices and realized, hey, I'm pretty good at making changes in the sound.
Yes.
I can listen to them and I can sort of internalize that and diagnose it by introspection. What do they need to change about what they're doing to make it sound better or different?
Hmm.
And so I think I started doing that at such a young age. And then when I went to my master's degree, I was recruited for that degree by a professor named Norman Spivey, and it was a new program at that time. And they there weren't that many of them. Masters in pedagogy were just unheard of, and uh, they recruited me for that, gave me a teaching assistantship, and I just loved teaching. I
Wow.
was just I felt like I am born to teach voice,
Hmm.
but I had a good instrument too, and so I was really torn. I felt like maybe I had the chops for the performance thing, but I wasn't sure, and I just couldn't get the vocal injury rehabilitation piece out of my head.
Sure.
And I lived really close to Philadelphia at that time when I was doing that degree, and so I started observing and spending time in a laryngology clinic.
Wow. So that
And
opportunity came up for you.
very early, and there weren't very many. I really wanted to be a singing voice specialist. That was what I planned. I didn't want to do the speech pathology piece. I just wanted to do the singing voice specialty. But here in the States, there are stronger lines, uh, somewhat between the practice of those things. And I realized after talking to people that I probably would not get to really be all that involved in the medical side of things if I didn't do the speech pathology degree.
Sure. Sure.
And so I was in my mid to late 20s, and I said, if I'm going to do this, this is the time. And I'd actually gone on and started my doctoral work.
Really? So you had
Yes,
started. Wow.
yes, I had started
Yes.
my Doctor of
Yeah.
Musical Arts,
Yes.
uh, and but I just couldn't get that I was envisioning this role where singers could have very specialized support for recovering from injury.
Yes. And isn't it strange in life sometimes you have that calling and you can't move away from it. That's it. That's all you want to do and nothing else. And you can try other things, but when your heart's in something, you just have to go for it, don't you?
That's exactly right, and I think that that's a great way to say that because looking back, I do think there was just this deep sense of calling, and but I was scared. I was scared. I had devoted my entire life to
Mm.
cultivating the craft of singing for
Yes.
for my own instrument. And I actually remember the day that I came home and officially said, okay, I'm doing this. I'm leaving performance behind and
Wow.
I'm making this change here. And it was tough. I was depressed for a while. It was a big thing to give up.
Hmm. But that would have taken a lot of courage. So good on you to make that call because look at you now. It's all been worth it. You're
It
doing
has been
great
worth it.
work. You're doing such amazing work. Okay, now I want to ask here, and this may be a really ignorant question. What is the difference between a voice therapist and a voice pathologist?
Hmm,
And is there a difference? Or
uh,
is it just into use of the same thing?
I think we interchange them a lot, especially here in the States. I think everyone kind of calls themselves something just a little bit different. Uh, I use voice pathologist sometimes uh, because I am involved a lot in the diagnostic process
Hmm.
and that pathology diagnosis and and I don't know it for me it really feels like it gives me some credibility on the science side of things.
Absolutely.
Yeah, but
Absolutely.
I think a lot of speech pathologists just use that. Uh, you interchange them. Voice therapist to me is a little more like colloquial. The pathologist sounds a little more credible sometimes, I guess.
So it sounds a little bit more qualified, more formal, more important. And we want to be,
Maybe. And
yeah, we want to be all those things.
right. My favorite, title to use is clinical voice specialist. I feel like that is probably the best representation of what I do in my days.
Yes. So in your work as a clinical voice specialist, what are the most common voice pathologies, or do you call them disorders? Pathologies versus disorders, or is that another
I
interchange of?
I don't use the word the pathology to me refers very specifically to a lesion on the vocal fold.
Oh, right. Okay.
Uh, right. So I probably say disorders
Okay.
or injury more often, but I like disorders because I feel like disorders is a little more uh, a correct sort of categorical description of the
Right.
types of things because a lot of because so much of my practice is devoted to what we call functional voice disorders
Mm-hmm.
because muscle tension dysphonia falls in that functional realm.
Yes. Yes.
And so muscle tension dysphonia with or without pathology is the number one diagnosis in my clinic.
Really? Well, I was going to ask you about that a little later. So,
That's fine.
but I'm happy to go with you here. So, muscle tension dysphonia, that is really common, and it's more common than what people realize. And it's actually something that I've suffered from myself in the past. And it came at a time when I was completing my PhD. I was working 5 days a week as well as doing completing my PhD on a full-time basis. So I had no life. I was absolutely just running on adrenaline the whole time. And I was tight as in every part of my body.
I'm
And
sure.
I was diagnosed with muscle tension dysphonia. Now, do you want to explain what that is?
Sure. Well, uh, muscle tension dysphonia. I mean, one of the things I want to make sure I say first is that it is a bit of a it's a bit of a wastebasket term
Oh,
sometimes. Uh,
okay.
in
Throw it in the
that,
bin.
okay, no, and just being like a lot of things go in the bin, and here's what I mean by that because when we it means that it's a big umbrella term
Right.
for when a doctor doesn't see anything wrong from an organic or physical standpoint with a larynx, which is what we want, right? We don't want to see
Yes.
things.
Yes.
Uh, Even if they don't really see muscle tension, 'cause it's kind of hard to see that, that's what we diagnose the person with when the voice is a little, something's not working correctly or
Yeah.
well about the
Yes.
function.
Yes.
And so it encompasses so many things. It can be primary or secondary, but basically, the way I like to describe it to my patients and my students is that there are very particular muscles intrinsically in the larynx that are responsible for vocal fold vibration and closure,
Mm-hmm.
adduction, and that
Mm-hmm.
process. And we don't really want the extrinsic muscles and operators involved a whole lot.
Right. I
And
understand.
and so what happens in muscle tension dysphonia usually is that there are muscles that are not supposed to be involved in that process become involved. We start recruiting help from them
Mm-hmm.
with compensatory strategies,
Yes.
and then the body learns what it learns,
Mm-hmm. And it becomes
and
habitual.
that's right, the brain learns it. And we're looking, and especially singers, like we're from the moment something doesn't sound right or feel right, we start looking for a way around it.
Yes. Yes. I call that manipulating. We start to manipulate. And
Yes, we do.
that's why often, like when it comes to my singing students, I can tell more so in their speaking voice if there's a disorder rather than their singing voice, because in their singing, when we sing, we can learn to mask it and, as you said, work around it. But it's very hard to disguise in a speaking voice.
Yes, you're right. Well, because we're not as aware of technique usually. One of my mentor talks about, like, how as singers we were really good at dressing up our voices. Like we
Mm-hmm.
put all the layers on, we put our most beautiful gowns on, and our coats and our hats and our scarves, and we dress it up, and we're good at that.
Yes.
We're really good at that. And
Yes.
so it can develop all by itself as a primary issue, but a lot of times muscle tension dysphonia is a secondary diagnosis to another diagnosis.
Really? Okay.
Yes.
So many questions here. One, what causes muscle tension dysphonia? So, what are those primary and secondary problems that are going on?
The primary, the most common example is, well, there are two I can think of. One is like nodules or polyps, but especially nodules, very common for singers to develop uh, the muscle tension patterns while continuing to sing and speak with injury present.
Okay, so that's pretty serious.
Right.
Mm-hmm.
And and then uh, there's a lot of muddy waters sometimes in treatment, because I have to sort of suss out, what's the main issue here. Are we dealing with an issue because of overuse? Is this person truly overusing their instrument and that's why they can't get better, or is muscle tension the primary issue?
Mm-hmm.
And I work very with a group of laryngologists here in the Chicago area who are super, super savvy at diagnosing muscle tension dysphonia in the singing voice. And that's why so much of my practice involves that. Usually, what we see on an exam, just to be really clear here, we usually see a gap of some sort between the vocal folds where they do not come all the way together from front to back.
Really? And that was what I was going to ask you as well. So, just say someone comes to your practice in that initial consultation, how do you diagnose disorder within a singer, or what is going on with the singer? What
Wait,
happens in that
can you say
consult?
that last part again?
Okay, so when, just say I'm a brand new patient or
Okay.
client, and
Sure.
I come to you, I've never been to you before, what is the diagnostic process that one goes through?
Typically, when I evaluate a patient, the majority of them have already seen a laryngologist and a diagnosis has been confirmed.
Right.
So, I begin. There are really three major components to my time with them in that initial visit. One is a very detailed dive into their history.
Mm-hmm.
We're going to talk first. I'm
Yes,
going to learn everything I can learn about that person, uh,
really.
and their personal life, their professional life, the role that voice plays in their lives,
Mm-hmm.
uh, what what's going well, what's not going well.
Mm-hmm.
What does your voice not do that you need it and want it to do for
Right.
you? You know,
Yes.
and so the history is first, and that sometimes that's not a big deal, and sometimes that's a really long, deep dive into a lot of medical things. The second piece is the actual vocal assessment or assessment of what I call vocal capabilities. So I'm trying to find out what is this voice capable of,
Mm-hmm.
and then what are its limitations.
Right. So how do you do that? Is that through like a spectrograph or a scoping?
Not right now. When I was me, I'm primarily still virtual and teletherapy right now. So the majority, I sort of did away with a lot of my more formal assessment things online. I've also been doing this a really long time, and I'm pretty good at just assessing it, things with my ears and the keyboard.
Mm-hmm.
so I do we do speaking samples. I try to find out like what can this voice do all the things that it should be able to do
Yes.
in the speaking way,
Mm-hmm.
meaning louds and softs and highs and lows and authoritative and uh, then we do a lot of sustained sound making, so long, just long sounds, holding things out. I try to assess the way the breath is working.
Mm-hmm.
Are there limitations in the breath? Uh, I'm listening to tone and and coming up with how do I describe this tone? Is this a clear tone? Is it hoarse? Is it husky? Is it breathy? Is it are they straining? Are they working too hard? Uh, and then singers, if it's a singer, which it usually
Yes.
is,
Yes.
we go into more subtle nuances.
Mm-hmm.
Staccati. I want to know what can they do with staccato, legato lines, and transitioning between vowels, and what is the range like? Is this a balanced vocal range from a registration standpoint, or is there a lot of imbalance?
Mm-hmm. That's amazing. And what causes muscle tension dysphonia? Usually, well, what is the most common cause that you see in your practice?
Uh, Usually the voice either there's an overuse component or that is either one time or repetitive,
Mm-hmm.
uh, where they're never quite recovering to their baseline and then they fall into those compensatory strategies
Sure.
and I call it just kind of getting off track. There's also mis lack of use. So, the disuse or too much too much vocal rest. That happens a
Right.
lot. People are
Right.
scared. They rest too much for too long,
Uh-huh.
and then they try to come back to singing, and then it's not working like it's supposed to. Another circumstance is getting sick,
Mm.
getting
Yes.
ill.
And people what perhaps returning to work a little too soon and not fully
Right,
recovering.
right. Or the body, the physical body comes back to normal, but the voice never quite comes all the way back. There's just something a little off,
Ah.
and And the thing is, though, singers, like I said, we're really good at making things work. So I think a lot of singers just band-aid things for a little while,
Mm-hmm. Yeah.
and
Yeah.
then the muscle tension grows. The other thing I just want to make sure I mention, because this you had asked about the primary versus secondary, another very common, sometimes underdiagnosed issue that where muscle tension can be secondary to it is vocal fold paresis,
Oh, okay.
which is a weakness
Mm-hmm.
in the nerve
Right. Okay.
in the nerves, and so that there's weakness. There's sometimes the vocal folds get kind of floppy, or one's not vibrating and moving the way it's supposed to, and that's very common in the singing voice too.
Okay. So how do you treat muscle tension dysphonia? I know when I was diagnosed, I was given like accent breath work to do.
Hmm.
I was given straw phonation, puffy cheeks, that kind of thing, and working on breath. And I know at the time because I was so highly strung that I was holding my breath a lot.
Yes, yes, breath
Uh,
holding is very common with muscle tension dysphonia.
yes, and that
Um,
came from tension, and also the back of my neck was really locked. So I was
yes,
given a lot of exercises to loosen the back of my neck.
yes, yes. Every person's priority list is a little bit different.
Of course.
I'm a little out of the box as a speech pathologist in the way that I treat voice. I don't follow like uh, the typical methods. I sort of create little blends of my own things based on what I think is going to work, and I really rely on my skills as a singing teacher.
Mm-hmm.
In therapy, I rely on those skills so much.
Yes.
And so usually I refer to it as kind of an unloading process.
Yes.
So we begin with, let's make sure the breath is unlocked. We're going to move, we're going to work with flow. We call it flow phone. We flow the breath.
Yes.
uh, Usually there's a component of like laryngeal massage, and
Mm-hmm.
I do something called trigger point therapy, where we're sort of isolating specific areas and applying pressure, and trying to figure out, what does that do? Does that change what's happening? uh, so then we begin with unloading, but I'm really particular in my process, because even while we're unloading, I'm being very sneaky about getting other things going without the person knowing that
Yes.
that's what I'm doing. Yeah.
Okay.
So while we're unloading, I'm already choosing sounds for their therapy exercises where I can tell that they're getting really clean, clear adduction and better vocal hold positioning,
Mm-hmm.
uh, really efficient voicing. So really, I just use my ears in a trial and error sort of way to determine what results in really, really efficient voicing for this person.
Yes. Yes.
And then that's all we do for a little while.
Okay.
And
So it's
then
just repetitive work to begin
it's
with.
very repetitive. We start with very short, frequent practice, and we get results usually, I mean, very quickly. Usually the person is feeling better when we finish the first session. And they go away and they do it. And as the voice becomes more efficient and we're unloading and peeling back the layers of tension and so forth, then we get in there and we start building.
Mm-hmm.
And we're going to build, and we're going to start to work on resonance and oral shaping and vocal tract shaping, uh, and then we move into vowels and tongue positioning, and I mean it's just a lot of different things.
It's like a massive can of worms.
It is.
It's a lot, isn't it? That's
It is a
that's
whole lot.
incredible. I just want to move on to now. There was when we had a meeting some weeks ago, you talked about vocal fold swelling as well. That is something that is very, very common. And many voice users who, like professional voice users, don't realize that they have it. So, do you want to talk a little bit about what that's all about?
Yes, that's one of my favorite things to talk about.
Oh,
So, well, I have learned this kind of comes from my knowledge about swelling and how it comes and goes in the life of a singer or a professional voice user comes from taking people through that process of resolving swelling and injury, and helping them learn the day to day, week to week balance of how much voice and how much silence does it
right.
take to
Yes.
balance. And so vocal fold swelling, I mean, really, swelling is our body's way of trying to protect us.
Mm-hmm.
So you know, vocal fold vibration, is it is a biological thing. It is not infinite.
Mm-hmm.
And so there is a limit.
Yes.
We all have a limit. Your limit and my
Yes.
limit are different.
Mm-hmm.
And And so the thing about swelling and vocal fold vibration, did you know that there is no other tissue in the human body that gets subjected to the kind of trauma that vocal folds do on a daily basis?
I'm not surprised because we're constantly using the vocal folds not
Right,
only to phonate, but they have other little jobs that they do as well. So,
right.
yes, yes.
So we vibrate so much, and if we go past the limit, the
Mm-hmm.
vocal folds are going to there are going to be these little cushions that kind of pop up, on the vibrating edge of the fold to protect us. But when that little cushion pops up, something's going to change about the voice. And we have to know and our body or our voices are going to give us a warning signal that that swelling is present. Now, if you're not a singer, you might not ever
Yeah,
know.
yeah. So, what are the warnings? And I didn't ask what the warning signs are of muscle tension dysphonia either. So, how can we tell that we have something sinister going on or potentially sinister?
There are some really key common signals, warning signals, I like to call them, for singers especially. And I do work with non-singers, but just for the purpose of our conversation, I'm going
Yes.
to use that. And remember, the outer edge of the vocal fold is the mucosa. So
Mm-hmm.
we are referring to mucosal swelling in this case.
Yes. Yes.
So the number one thing is loss of high, soft singing.
Ah, that's interesting because even in, I mean, how many students come to me and they say, I can't sing high softly. The only way
Yeah.
I can sing high is if I sing loudly.
Yeah. So, we don't know. We never know unless we look, right?
Mm-hmm.
But it's one thing for someone to say, I've never been able to do those notes that way, but it's another thing for someone to say, I can't sing above G5 today. Like I've lost everything above that. What's going on?
Okay.
So, but loss of high soft singing, because even the smallest of vocal fold swelling might not interfere until soft head voice or soft falsetto.
Mm-hmm.
And you have to get quiet to notice it.
Really?
So the loss of high soft singing, uh, day to day variability.
Aha. So the voice behaving itself one way on one day, and the
Yep,
next day the voice behaves differently. So the voice is inconsistent from day to
yes,
day, and
exactly.
you don't know how it's going to behave. It's just
Right.
random.
Right. But there's almost always a pattern in there. And that's one of the fun things is helping people find those patterns. So the other really common things are onset delays,
Mm-hmm.
air escape in the tone,
Yes.
and increased effort.
Right. Okay.
So those are probably the top 5 warning signals that come out.
Hmm.
Uh, Another thing that kind of stands out just for like our listening audience. So colds and viruses and upper respiratory type things, even allergies and reflux and all these things that can really cause havoc in there. They do cause they cause what we refer to as more global swelling in the environment. So the whole area is going to be inflamed and
Oh,
irritated,
right,
right?
right. Not just the
Vol-
folds.
right. Vocal fold swelling is focal. So so if someone happens to have a little baseline swelling,
Hmm.
that other swelling on top of it is going to really just make that voice very impaired.
Okay, so it's going to wreak havoc.
Right, right. So now vocal fold swelling, while I get very excited about this topic, people get stressed out about it because it's a scary thing sometimes. But the
Hmm.
reality is, when we are a busy vocalist, when we have very high expectations of our voices on a daily basis,
Absolutely. Yes.
and we don't listen to the warning signals a lot of times,
Hmm.
and we say, well, I got to teach that lesson and I've got to sing that rehearsal, and so when you ignore the signal, even if it's the smallest little signal, but then that signal keeps showing up, then you're moving towards something a little more chronic.
Hmm.
So regular monitoring, knowing how to monitor mucosal swelling is important. Now, one of the things that's confusing is the difference between is okay, I didn't say vocal fatigue, and I should have said vocal fatigue because that should be in the list of common complaints.
Yes.
Vocal fatigue could mean so many different things.
Hmm.
How do we know what it means? And so I talk a lot with my singers about the difference between, is what I'm experiencing a mucosal swelling issue from
Yes.
overuse, or is it really a muscular thing?
Wow. Okay.
And how do we know the difference?
Well, that's something you can diagnose, obviously.
Well, we have to suss it out. We talk about, okay, tell me exactly, we talk about the exact things. So, what I have learned, now this is all anecdotal, there's no paper out there, but this is based on close to 18 years of clinical experience here. And what I have learned is that it takes a characteristic of vocal fold swelling is that it usually takes a little while for that to show up in the voice.
Right.
You're
Okay.
not going to notice swelling like immediately. It's going to be like a few hours later, or sometimes the next morning
Hmm.
is when swelling shows up.
So, one thing you mentioned to me when we were chatting some weeks ago was that with vocal fold swelling, usually people, when they wake up in the morning, that it takes their voices some time to warm up. Was that correct?
Well, it depends. It depends. If you don't have any swelling,
Mm-hmm.
you should be, ready to go pretty quickly. What I may, what I'm, you may be referring to is
Yes.
that, okay, so if if you want to try to find out, am I swollen today? How do I know? You can just test your high soft voice.
Mm-hmm. Happy birthday to you. Happy birthday to you. There's a little
You just
break in
test
there,
it.
but that's
Yeah,
okay.
right. But I know in my voice,
Mm-hmm.
and you go into falsetto or your very high head voice, you get really soft, like you just want to be able to be super soft like that.
Happy birthday to you. Happy
Right.
birthday to you.
Yeah, yeah, that's how you do a swelling test. So if I were swollen, this is what I'm going to sound like.
Ah, there are times I do sound like that.
We all do.
Yeah, especially after a really long teaching day. Some days I may teach for 12 hours
Ah,
without a break. I mean, the next morning I may be a bit tired. Or if I've been out and been in a noisy restaurant
yes.
and having to have big conversations with a group of people, that is another time it happens in the morning. That's probably my worst, is being out in a noisy environment.
Yes, but see, we all do that. And then
Hmm.
the next day, we'll be warming up and be like, like those notes aren't, something's kind of weird up there. They're not working as well as they usually do. But we just flip it, whatever, it's fine. I'm probably just a little tired. But
Yeah.
are you really tired or are you swollen?
Yes.
And so now the muscular, just to kind of finish that thought. So swelling usually takes a little while to show up, but it also takes a little longer to go away,
Oh,
right? So
okay.
so now we want you to recover overnight. That's what we want.
Hmm.
No more than 1 to 2 days. Muscular issues. So if you start to feel fatigued and or even getting a little hoarse, muscular almost shows up immediately. Like that can
Right.
happen like right
Right.
away.
Right. I had something that was going on with my voice many, many years ago. It was the only time I had some sort of disorder going on. And
Mm,
I was touring in a rock band. And, I'd had a big career already. My voice had always behaved itself, never had any vocal issues. And with this rock band, I blamed the lifestyle because there were a lot of things going on, a lot of heavy lifting, lugging gear, very late nights, not sleeping properly, lifestyle, eating bad food, the position of the monitors on stage where I couldn't hear myself and trying to sing loudly to be able to get some sort of
sure.
like oral feedback, and also the demands from management that we'd have media on the days off and all those sorts of things. And it started off that very slowly, that one day, my voice started to become a little shady, and to the point where it got to I after not even finishing one song, my voice just cut out.
Yeah.
And
Well,
that's when I knew I was in deep trouble. But I knew there was something going on earlier, and I was doing my best to try and keep going, because in the industry, it's all about the show must go on.
yeah.
But how many people come to you when it's too late? Like, they don't listen to the warning signs. They know something is up, but because if we don't work, we don't get paid, we keep pushing through. Do you see that a lot?
Yes, absolutely. And I don't ever feel like it's too late. I really
Mhm.
don't. I don't I've had too many successful experiences with singers, bringing them through the injury experience and journey and recovery, whether that involves a surgery or not.
Mhm.
Sometimes it does. Sometimes surgery is exactly what that person needs to get them back to original equipment, or as close as we can get them to original equipment. And
Yes.
if you've got a great surgeon, there are no, there are rarely, issues with that. Uh, and I love that. I love helping singers recover from surgery. It's a really
Mhm.
fun process.
Right.
But a lot of people, a lot of the people that I see with official vocal fold injury, now not the technical aspects or functional aspects of muscle tension dysphonia. I talk about those a little separately.
Mhm.
I don't call muscle tension dysphonia an injury.
Right.
uh, but most of them have like pushed the voice past that limit so many times, not really understanding what was really happening in there.
Yes. What are the worst injuries one can have as a singer? What would be your worst nightmare,
Oh gosh.
would you say? What would
Um,
what would you not want to have?
mm, I wouldn't want to have an injury that was under the surface of the vocal fold. So usually vocal fold cysts
Hmm.
form under the surface.
Right.
And so, but I'm going to take that one step further. If you continue to work on an injury that's very obvious, um, and if it were a cyst under the surface, it can burst, and
Okay.
and long-term damage can cause a little something that we refer to as a sulcus. So that means there's like a little divot in the mucosa. There's like an actual little furrow
Yes.
or divot
Yes.
in the tissue.
Wow. Okay.
um, and it turned, it's scar like, it's got scar tissue, and it can be dealt with surgically, but it's a really, really difficult thing to get improvement in.
Right.
Uh, and most other, but I've helped. One of my favorite post-op cases, or preoperative and post-operative in my memory, uh, was a young singer, a college student, who had two cysts, one on each
Wow.
side.
Wow.
And so when we're dealing with something like that, because you can't operate on both sides at once, you have to do them separately. So you have to do the first surgery, and then it's like months of recovery. And then we do the second one, and then it's another stretch of recovery. And it took a good year to get that singer back on stage. But it was such a rewarding, joyful thing when it was all over, you know?
Yes. So would that be the worst case that you've seen?
Mm, I don't know. I don't really rate them like worse. And
Well, has
uh,
someone come to you and you've just gone, wow, this singer has some serious problems going on. Houston, we have a problem.
we have a problem. I think the worst situations like that are when the vocal fold tissues are just so beat up from a lifetime of asking more than they should have.
Hmm.
And
Yeah.
yeah, it is possible to continue to sing pretty well. I mean, there's some pretty high profile singers with vocal fold injury that probably have very little vibrating viable tissue left.
Hmm.
And they're singing, they're still making money and doing a good job. So
Do you listen to those singers and go, oh my gosh, I just can't listen to that, knowing that
I
they're
I
injured?
I don't really. I'm very versatile in my listening. I'm appreciative and enjoy a lot of different singing styles. I grew up listening to pretty intense uh, heavy metal and
Hmm.
uh, rock, and I don't react that way. I mean, I'm appreciative of even those really aggressive sounds that we can make vocally, because I always say, our voices were designed to do this stuff for us.
Yes.
I
Yes.
mean, really, they were made to. But it for me, it's when when people just continue to push past without that awareness, and that makes me think of how hard it is for singers to go for help, to ask for help.
Hmm.
It's a mystery to me. It's
Yes.
such a mystery. It's why would you not go get answers?
But it's all
That's
about the shaming. There is
I
still
know.
shame around having injuries and disorders. I mean, look at poor Adele when she had her last lot of vocal injuries. The, I was totally embarrassed to be a voice teacher. I was ashamed as a voice teacher to read some of the commentary on social media forums from our
Horrible.
professional voice teaching
I know. I know.
community. I mean, I can see why they don't go and have help, ask for help. It was shameful. It was shameful what I was reading. And people seem to have all the answers and they
People,
don't
well,
know.
and yes, voice teachers, we do. We feel very knowledgeable,
And very opinionated. And can
very
I tell
opinionated.
you, unless you've walked the walk and you talk the talk, you don't know what's going on in a person's life. Now, for example, I had vocal injuries or a disorder, whatever it was at the time, but that lifestyle was not helping. And you don't know.
No.
Now, Adele had done something like 100 shows. It was her last show. She'd been on a flight every second day. Come on, people.
It
And
is it is a brutal lifestyle. And what I want, and I always chime in when I feel, when I get my feathers, a little ruffled, I want
I
to
am
chime. I'm like,
right
okay, here
now.
I come. And
Yes.
I say, my pushback is, okay, people, this is not, she didn't do anything wrong.
No.
She's singing. Do you know how many shows she's singing every week?
Yes.
The voice was not, it was designed to do amazing things. But remember, I said it isn't infinite.
Yes. And also, too, I mean, it was a lot of the classical voice community that was chiming in on all of those forums. And they only have to sing a few songs and then they go home. I mean, when I was singing professionally, there was a time when I was a single parent and I had to put food on the table for my daughter, and I was taking every job possible. And there was a stage that I was working 11 gigs a week. The
Oh,
minimum, the minimum I was doing was a 3 hour call. And then,
wow.
so I was working from 7 till 10 and then going to a nightclub. That was 7 nights a week doing that. And then 4 nights a week, I would go into a nightclub and sing from 10:30 till 3. Now, that's not getting up and just standing there. Sorry, classical singers, but we have to move. We have to have banter with the crowd. We have to speak to people in between. Our
Right.
voices don't get a break from the time we arrive till the time we finish. So
No,
it's
I
completely
agree.
different.
And the thing that you know, I I dream I dream of a world,
Hmm.
of a voice world where we all understood those nuances of swelling, and I dream of a world in academia and in private studios and in the theatrical world and in the commercial singing world where everyone gets education in that.
Hmm.
What is it? How do I know if I've done too much? And what does that really mean when I feel like that?
Yes.
Because if
Yes.
everybody knew that and knew how to test for it,
Hmm.
we could cut some of these things off at the pass,
Yes.
and that's how I work with my patients. I don't let them, I say, no, we're going to monitor this and we're going to test it every single day, and you're going to write down what that is.
Hmm. Hmm.
And
Yeah.
you know what, it empowers them to make really good choices.
That's fantastic. Okay, I'm going to ask a very controversial question here.
Uh-oh.
And Laurie, I would really appreciate an honest answer.
Hit me.
So
Hit me.
we're not going to faff. That's what Australian term. We're not going to faff for a particular community that exists within our
All right.
voice teaching community. So, when it comes to injuries and disorders, are CCM singers more likely, or do you see a higher incident of problems within that group of singers than classical voice singers?
That is a great question, and not one that I think about a whole lot.
Well,
Uh,
that's good. So you don't have biases.
I really don't think I do, Marissa.
Yay. For a
I really
soprano
don't.
from the classical world, I'm very
No,
proud of you.
yes, no, I don't. I see all genres equally in my practice, and styles and environments. And, uh, I do. The only thing I would say is that, uh, and this is from the muscle tension dysphonia side of things, because
Hmm.
when I mentioned that issue with a gap between the vocal folds,
Yes.
and usually the gap is towards the back of the, so if you're looking at vocal folds on a screen, and
Mm.
there's going to be more of a gap in the back here, uh, I do tend to see that shape of the gap, in belters that take chest voice a little too high. That's the only thing I can think of, but that's not necessarily like an injury type thing. It's more of a
Hmm.
technical thing that,
Okay.
that gets imbalanced, and so we just have to teach them how to rebalance that. But no, as far as injury is concerned, I mean, everybody walks through the door. They're coming from all different. I mean, I see impersonators, uh, from Elvis impersonators to the upper echelon elite, uh, classical soprano at, the opera house.
Hmm.
I
Hmm.
mean, and everything in between.
Yes. So what you were talking about, sorry, about that belter, that's obviously a training issue. They haven't been trained correctly
Yes.
to belt that high. And I love that you've said that people come to you from all walks of life. They sing across a variety of genres. No one is more problematic than others. And because to me, this would be my assumption, and it's not based on anything other than the sheer workload that these singers have to, uh, their workload, not only in terms of singing, but they have to speak as well, is
Yes.
musical theatre singers. I worry about them because of all the different styles that they have to be able to sing across. It's basically non-stop for a lot of them for 2 hours on stage. Everything else, the positions that they have to sing in, I would assume that they could possibly end up in trouble more so than
Well,
singers,
but
other singers.
from my perspective, part of the problem with that, a big part of the problem is they're getting confused. They get confusing messages in terms of vocal health, like the value of their vocal health and the priority of, their vocal health in the rehearsal situations, in the way programs are put together, course curriculum, the training, the
Mm-hmm.
way it's all built. Because we don't we want you to be careful, and we don't want you to injure yourself, and, we support you and we care about that, but we're going to run this show twice today.
Yes.
Okay, okay.
Mm-hmm.
So
Mm-hmm.
where's the logic in that? I
Yeah.
mean, there's no way. There's no way. Especially young singers, there's no way that they can handle that kind of load. And see, that's confusing to them, because then they feel like this is being presented as, I'm supposed to be able to do this.
Mm-hmm. Yes. And do they,
And then when they can't,
yes,
they feel shameful.
exactly. And do they have a support team in the US for musical theatre singers? So just say if you're in a production of Hairspray, that production show has uh, different therapists that like physiotherapists. They have
That's
someone.
a great question. There, I think there's definitely more of that happening, like on Broadway. That's probably one of the few, locations where
Mhm.
more of that is happening. But at regional theaters, local theater, I mean, even I don't know with touring companies. That's a great question. It would be a good question for someone who's familiar with that.
Yes.
But 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 at the regional level, local level, in the school, people get hired to be vocal directors, and they half the time, a lot of times, the vocal director isn't very familiar with injury and how to protect the students from that. And
Mm.
so then they're putting forth these expectations, and then they all wonder why when you get to tech week and we're 2 days before the show, nobody has a voice.
Mm. Mm-hmm. Yes. A lot of the
And
time, people in those leadership roles, because I know this, my daughter works on cruise ships, and I know that the, for example, the vocal captain is not necessarily someone who has the most training. It's someone who sings
right.
according to the production team, who's the best singer, who might
Hmm.
be the most experienced, or may have had the greatest career leading up to that contract, but has no knowledge of how the voice works.
Right. Well, and see, another thing that's kind of tricky about vocal fold swelling and injury is that it responds really, really well to warm up. So
Mm.
if you can cover that up pretty quickly with your warm up, and the voice responds to that and it gives in. And so that's why we want to teach singers to monitor before they warm up, so that they have some sense of what that naked voice is
Right.
like.
Yes. So, what is your favorite warm up, or what would your preferred warm up regime be? What would it involve?
Oh, mm. I like to start with something that gets the airflow moving. So either lip trills, tongue trills, raspberries, usually one of, or straw phonation in
Yes.
water.
Oh, you
Uh,
prefer in water?
yes, yes.
Mm-hmm.
Well, to start out with, usually.
Mm-hmm.
So I lots of gliding, just lots and lots and lots of a lot of up and down to begin with. So I usually want people starting with airflow of some kind, moving it. Then I just like sustaining tones on something that feels really good. Voiced consonants are
Mm-hmm.
really valuable, like V's and M. My favorite warm up for muscle tension dysphonia is the L consonant.
Really? L.
Oh, oh.
Oh. Okay.
Yeah. Yeah, I work with
Okay.
L a lot in therapy.
So, what does that do? Why do you like the L so much?
Well, the tongue is, I mean, we you know this. The tongue is a muscular hydrostat. So it's, you change the shape in one place and it just distorts in another, right? So so when we make that L position with the tongue, it's sort of in this, it's in this sort of diagonal position. Oh, but the root of the tongue goes to such a position back there that it aids in vocal fold adduction and closure usually, and it's really great for mixed voice.
Okay.
Yeah,
Okay.
and so I love L. My favorite of all time. If you said to me, Lori, forevermore, with all of your students, patients, injury, healthy singer, injured singer, whatever you want to call it, if you could only pick one exercise to carry forward forever and ever and ever, and it's the only one
Yes.
you could use,
Yes.
it would be the word knoll. Knoll.
Knoll. Knoll.
Knoll. Like a
Knoll.
grassy knoll.
Knoll.
Mm-hmm.
Really?
So let me demonstrate. Knoll. No, no. It's just this perfect little combination of the
Mm-hmm.
N, the O, and not necessarily saying the L, but sort of thinking the L.
So, one question on that. When you say the, so is it a diphthong that you're using? So is it just
No.
no, or is it no like an O E? Like, is it an O?
Oh,
Oh,
it's more oh.
okay,
The way I
okay,
teach it, it's more oh.
Okay, okay. So it's still that Italian vowel, like more you're sitting on the
Yes.
open part of the first vowel and you stop it there.
Yes. Now, the
Okay.
challenge with it, it works really well across genres, and I mean, I just have so much success with it. It sort of comes from a very beloved exercise routine, therapy exercise routine that was uh, created in the 90s by someone named Joe Stemple. He was a speech pathologist that he just retired in recent years, but uh, Noel was sort of came from one of the exercises in this regimen that he called vocal function exercises,
Mm-hmm.
and he didn't really say it was Noel, but when you watched and listened to him demonstrate it, that's what you heard. And
Okay.
so that's kind of where it came from. And so I've been working with that sound in my choirs and solo stuff. I have a lot of success with it. Now, the challenge is that for these CCM singers, it's not the best vocal shape. I'm sorry, it's not the best vocal tract
Oh,
shaping
yes.
for what they need. And so
Right.
I use it more therapeutically with them. And then when we need to cross over into more training aspects, we have to abandon that usually and find something a little more
Okay,
appropriate.
because it's lowering the vocal tract. Yeah.
Yeah,
Yeah.
it's too long, and yeah.
Mm-hmm. Okay. So what is your favorite cool down? Because singers generally forget to cool down or they don't realize the
Mm,
importance of a cool down. What would you suggest?
my favorite cool down, there are two, either straw phonation
Oh, okay.
or lip trills. If you can
Really?
do lip trills, and I like downward, like descending glides.
Mm-hmm. Mm-hmm.
I teach my singers to do a lot of downward movement with the voice for cool down.
Okay. Because one of the most popular cool downs here in Australia is just doing like some vocal fry.
I like vocal fry. Yes, I love it. I teach I have a whole um, barrage of therapy exercises and singing exercises that come out of what I call creaky voice,
Mm-hmm. Yes.
which
Well,
is the
yeah, okay.
creaky noises,
Yes.
and yeah, and no, I love vocal fry. I only recommend it for cool down or relaxation purposes when I have my muscle tension dysphonia singers that need something to sort of pull them out of that kind of intense place.
Mm-hmm.
But I that's interesting. That's very interesting to me.
Yes, well, it's
I like it
supposed
though.
to bring everything back to neutral and back into, especially for high belters where the larynx has been floating from that neutral to
Yes.
high position. It just
Hmm.
brings everything more into a neutral position again.
I love that, and I'll buy that. I
Okay,
love
well,
it.
I taught Laurie something. I'm so proud. Now, we're down to the last final questions. You've been amazing. And I'm just going to ask you, this is for my students because I've had a number of students who have recently had COVID and they've come
Mhm.
in with some vocal issues. They're saying their voices are not behaving. That is actually the words that they're using. They're
Okay.
having some little funky pitch issues going on. So every now and again, the voice cuts in and out.
Mm,
Um, but they can't rely on their voices to do what the voice was doing prior to COVID. So there's a little bit of lack of control over the voice, for want of a better
okay.
word, because we don't like to use the word control, but the voice is not responding perhaps the way that it used to prior to COVID. Is this something that you've seen with any of your
Yes.
patients?
Yeah, sometimes a lot of it's interesting. I have a lot of people that don't disclose that they've had COVID,
Mm-hmm.
uh, and not on purpose. They just forget to mention, oh, and by the way, I had COVID 6 months ago, and I have to kind of dig into it. But yes, I think that I would call I like what you're saying, like lack of control. I am seeing some of that. I think of it as sort of a um, I also think of stability.
Yes.
and like a grounding in the voice, like a
Yes.
grounded, stable instrument.
Mm-hmm.
And I think a lot of it is like coordination related,
Mm-hmm.
and so identifying. So what I've been doing is just kind of like my normal process, identifying, okay, what I always say with singers, we're gonna come down to the smallest denominator. We're gonna find the smallest number of things to think about when we make this sound to get better. And so finding a sound that really coordinates the breath with vocal fold closure and adduction, and
Mm.
then the resonance. They have to go together.
Yes. And I think the key, this would be my theory, would be that because COVID really does impact on breathing, the lungs, the
Yes,
breath, that a lot of those issues may be coming from uh, air pressure.
I agree with you. I absolutely agree with you.
Mm. That was the
Yeah,
thing that I noticed when I had COVID, was that it felt like someone was sitting on my chest and my breath was laboring.
yeah,
And I'm thinking that these singers, they're maybe because they are singers, they would notice it, whereas probably the average person wouldn't so much.
yeah. I've had a lot of I do a lot of uh, manual therapy and hands-on work with especially with muscle tension, but with breath work as well. And a lot of my singers recovering from COVID, we've had some success doing some like hands-on work where identifying like areas in the chest or the rib cage or the abdominal area where they might be able to identify holding of tension. And so
Mm,
even sometimes just pulling, like putting the hands on the chest and kind of pulling away, anything
yes,
to sort of open those
yes,
spaces up a little
yes,
bit. and
yes.
and that's kind I've had some success with that. As simple as it is, it's amazing
Mm-hmm.
how they start to feel some control over the breath with that. And then the voice is going to come out smoother and more
Mm-hmm.
coordinated.
Yes. Well, thank you for answering that on behalf of all my students.
Sure, sure.
Okay, so final question. And then, by the way, we're going to share all your links with our listeners. So if people want to learn more about you, we will have all those in the show notes. And if they want to visit your website or make friends with you on social, we will share all that info with them.
I, I love it. I'm new on Instagram of late, so
Oh, yes. Well, I'm not a fan of social media, to be honest, and I shouldn't be saying this because there's a lot of promotion that goes on around this podcast on social, but I have someone that takes care of that for me.
it is. You
Sorry
know
to
what I call
say.
it? I say it is a labor of what I love. So
Yes. So, what can we, piece of advice for our singing voice community? What can we as teachers do better to take care of our students in terms of vocal health?
mhm, talk about it with them.
Mm-hmm.
I think we need to be having a lot more conversations in all of the spaces that we exist with our singers, in the studio, uh, in in classes, in the theater, in backstage, and at the concerts. I mean, we need to be talking about asking,
Mm-hmm.
"How's your voice doing? Do you ever notice changes in your voice?" That's that monitoring piece. But if we talk about it with them openly, share our own experiences of limitations or problems that we've had, it opens the door for them to that they recognize, I think, this is a person that I can talk to about this,
Mm-hmm.
and I don't have to be fearful of bringing this up in
Mm-hmm.
conversation.
That's great advice. And that really goes along with what I try and advocate through the show, and that is holding safe spaces for our
I love it.
students. to be heard. It's not about us. We need to leave our biases at the door, but listen to what our students are telling us.
That's right. That's right.
And
And not swipe it away with a word like, "Well, your voice is just tired today." You
mm,
know,
no,
we
that
have
doesn't
to.
cut it.
Yeah, no, no, it really doesn't. And
No.
and also not swipe it away with, "Well, if you just do this differently, I bet it'll come out okay."
Yes, that's where we must learn to have conversations with our students and find out what's really going on, don't
That's
we?
exactly right. Because
Yes.
I can tell you from my side of things, being the professional that's supporting them in that recovery journey, that they need and want that so desperately. They're so
Hmm.
afraid to tell you what's going on.
They are, unless you build that trust within the studio. And we
That's
have a
right.
responsibility as voice teachers to take care of our students and to make sure that they're vocally safe. And
We
the
do.
only way that we can do that is to allow them to communicate with us what they actually need and
Yeah.
to listen
Yeah, I
to them.
agree.
Yeah.
I agree.
Well, Laurie, it's been amazing. I've loved listening to everything that you've had to share with us. You've been really generous with your time. It's been a long interview, but I just wanted to keep knowing more. And the
Oh,
listeners are going to learn so much from you. Thank you for your time. And good luck. And I'm sure we're going to catch up sometime soon. I must come back to Chicago. It was,
oh, I
I,
hope you
I
will.
love Chicago.
I would love to host you here. We'll come
Oh,
and
okay.
we'll have a good
Okay.
time.
I know we will. Okay. Thank you so much. Take care.
Thank you, Marissa. Bye
Okay.
bye.
Bye.